In the last few minutes, we've discussed the structure of your back and spine, the common causes of back pain, and a back treatment called VAX-D, a safe and effective alternative to surgery. You've heard from actual patients who suffered from back pain and have found the relief they needed with VAX-D. And you've seen reports from medical studies that have found VAX-D to be safe and effective. But what makes VAX-D more effective than other common treatments? First, let's take a look at traction, a treatment that is often mistaken for VAX-D. Here to discuss traction and why it isn't as effective as VAX-D is orthopedic surgeon Dr. Howard Berkowitz.
At our clinics, we use a patented system of spinal distraction. We get 3 out of 4 of all of our patients better. We treat a wide variety of back problems, including people who previously failed back surgery. We successfully treat herniated discs, ruptured discs, degenerated discs, and facet syndrome, as well as failed back syndrome. Some of our patients think that what we're doing is traction. In fact, that's not true. What we do is spinal distraction. It's very different than simple traction. Traction's been shown for many years to be truly ineffective. The reason behind this is the body's tendency to pull back when a distractive force is placed against the muscle. This is often called muscle guarding. Our form of spinal distraction overcomes muscle guarding through a patented process that applies the distractive force through a computer-controlled mechanism. We've been successful in over 3 out of 4 of all the patients we treat. Now, when anybody is successful, you're bound to have imitators. It should be important to note that none of the imitators can back up any of their claims with research. Our treatment is the only such treatment which has multiple published reports in many prestigious medical journals which show consistent results of over 70% improvement. The reason for this is the patented process of spinal distraction, which overcomes muscle guarding. This enables the bones to actually separate one from another and create a negative pressure inside the disc. Negative intradiscal pressures are the key to recovery and healing of the disc disease and herniation.
VAX-D therapy is unique in that it actually decompresses the spine, relieving pressure on injured discs and creating a natural healing environment so your disc can heal. Multiple medical studies from the United States to Canada to Australia have supported VAX-D and proven its effectiveness. Other treatments like traction may claim to decompress the spine, but they do not have published medical data to support their claims. VAX-D has proven to be more than 75% effective. Another benefit to VAX-D is that it is non-invasive, meaning there's no incisions, no anesthesia, and no operations. Because it's completely non-surgical, there are no side effects and no long recovery periods. Did you know that back surgery is the 3rd most common surgical procedure performed? Or that the rate of spinal fusions, one type of back surgery, has tripled in the last 10 years, but outcomes have not improved. Furthermore, 60% of all people who have successful back surgery will be candidates for repeat surgery after only 2 years, with only a 40% chance of success after a second surgery and a mere 5% chance after a 3rd. Before you consider surgery, call today to schedule your free consultation.